My background is in exercise. I started at St. Clair's in Schenectady, New York, doing cardiac rehab, and then I came to Gainesville and worked at the Alachua General Hospital for a few years doing inpatient cardiac rehab. And then for the last 6 years, I've been at the Alachua County Health Department doing health education through the Choices Health Education and Wellness Program, and most recently, as of this year, working on the Healthiest Weight Florida initiative. I'm also a certified personal trainer, so I've worked both in disease management and now, which is my passion, prevention. So I'm here today to talk to you about the Healthiest Weight Florida initiative and how it will impact you, what we're doing from public health standpoint to address the obesity epidemic. So I'm going to provide you with some information on the Healthiest Weight Florida, and I'm also going to give you some tips about healthy eating and active living. So just to start, this is an initiative to address the obesity epidemic. And so I just wanted to start by just defining what is obesity. Overweight and obesity are both labels for ranges of weight that are greater than what is generally considered healthy for a given height. And based on these different numbers, being overweight or obese has been shown to link to many chronic diseases. BMI is the body mass index, and that is how we are measuring it because it is easy to measure among large groups. However, it is not the most accurate. It only accounts for your height and your weight. So it's important to keep that in mind. But that is what we're using across the country because of research purposes in large groups. There are some outliers if you have a more athletic build or for different circumstances. It's just a general measurement. And I believe with the city you're able to get even more detailed measurements which are, give you a better picture. So these are some of the numbers in what is considered to be the different ranges. So just to show you why there's such an urgent push for doing something different, because something has happened that our obesity rates have tripled since the 90s now to 2010. You can see in the 90s, 2000, 2010. The number one public health threat that challenges the future of Florida is the challenge of weight. Currently, only 35% of Floridians are at a healthy weight. 1/4 are obese and the rest are overweight. Cost of obesity-related chronic disease is about $34 billion over the next 17 years. And this is just one of the reasons why it will affect all of us, because we all have to end up paying for that. And $34 billion is almost an entire state budget. So when money is going towards obesity-related diseases and things like that, it's not going towards other things that are more important. So this accounts for just these 4 diseases and not other things that are associated with obesity. And just to show you the landscape of Florida in comparison to the United States, it's about the same. We're doing a little bit better than the United States overall. 35% are at a healthy weight. But as you can see, overweight and obese high schoolers, almost 30%. So this is a major cause for concern. And here in Alachua County, just to show you some statistics, about 60% of adults are overweight or obese, and 38.5% overweight, 21.6% obese. And then here's some statistics that are a little more current for the school children, 6th graders. We've been able to get a little bit more current information for children, which is going to be very beneficial in providing support. But 37.74%. So we have a very high rate of childhood obesity in our county. And according to the 2014 county health rankings, unfortunately obesity rates showed to be increasing. Our physical activity rates were getting better, but unfortunately the obesity rates were getting worse. So where do we head from here? As far as public health and what we're doing to support all sectors is to try to build a culture of health. So something has happened in our environment and policies that we're looking at it differently, not in an individual blame or individual approach, but what has changed and how can we make it easier for all of you to make a healthy choice or an active choice? How can it be easy to pick the healthy food, the affordable healthy foods, and making those available, so those different things. And this is just a quote that I liked from Risa Lavisa-Mori from the Robert Wood Johnson Foundation. And it's pretty much gives you the overall picture of what we will be working on in public health. If we truly want to move the needle, we must start thinking differently, creating a culture of health that supports all people in making healthy decisions, regardless of where they live or how much money they have, requires the active participation of leaders across sectors, including businesses, philanthropy, community, healthcare, and transportation. And this is just a few, but basically we're taking a collaborative approach and having everyone at the table to make decisions on how we can make our communities healthier and make it easier to make the healthy choice for our residents. The Trust for America's Health. For too long, the country has focused on treating people after they become sick instead of preventing diseases before they occur. So we need to work on prevention. And we are seeing more support, which is really good. Of course, nobody wants to be sick, but it is more important than ever now to focus on prevention. So to respond to this epidemic in the state of Florida, the Surgeon General and the Florida Department of Health launched the Healthiest Weight Florida initiative. Healthiest Weight Florida is an initiative to address obesity. In Florida, they would like to focus more on healthy weight, a more positive initiative, and healthy communities rather than to focus on the word obesity. So it's much more than just a focus on weight, but healthy communities. It's a public-private collaboration bringing together state agencies, not-for-profit organizations, businesses, entire communities to help Florida's children and adults make more informed choices about healthy eating and active living. So how can we help you be able to make the healthy choice, the easy choice, everywhere where we spend the most of our time, where we work, where we learn, where we live, where we play? This initiative is based on the Institute of Medicine's recommendations to speed progress because of the numbers and where we are in the cost and how it is affecting our children. The Institute of Medicine has encouraged urgent, bold, sustained approach and to engage leaders at all levels. So to have everyone involved, everyone is part of the solution, to come together. So what we're working on at the Florida Department of Health in Alachua County is forming a group to specifically work on our healthy weight goals, to address healthy eating and active living in our county, and to support the residents and make it easier through collaboration among all agencies and organizations. This initiative is going to focus on 5 environments: physical activity, the food and beverage environment, the messaging environment. We've got a lot of messages, so we are focusing on consistent messaging. Healthcare and workplace and schools. So the areas where we spend the most of our time, and based on these different environments, will have the biggest difference, make the biggest difference. Healthiest weight strategies are to increase opportunities for physical activity. So you guys are very fortunate in, with the City of Gainesville to have these programs and to have the support from your workplace. Not all workplaces do, and we are really encouraging that. So worksite wellness is a very big part of this initiative to encourage all businesses to support employees and being able to be a part, get education, be a part of physical activity and nutrition activities, and give the opportunity and support to the employees. Also, to make healthy food available everywhere. And not just to make it available, but affordable. So we're working on access to healthy foods and with different organizations. Again, to promote health in the worksite, we already covered that. To strengthen schools as a heart of health, because children spend most of their day in the schools. So it's a very important area that we need to focus on. They're our next generation. Unfortunately, 6 out of 10 children that are born today or around now will be obese before they graduate high school. So it's the first time that this generation will have a shorter life expectancy because of the obesity-related diseases. We're finding children to have diabetes much earlier. We don't call it adult onset anymore. So that's the very troubling statistics that we're having to deal with, and to focus on making an impact in those crucial years from 0 to 5, and then when they get into school too. The goal is to slow down the increase that we are seeing with obesity. So the goal is to bend the weight curve by 5%. And if we can do that each year, we will keep it down. It will still be very high compared to other countries, but it will help keep those costs down that are just not sustainable. So as for you, the focus is to, again, help with healthy choice, make easy choices, healthy, active choices. So just wanted to share with you, this is just a campaign that another county is using, and we're just starting our coalition here pretty much to focus on healthy weight. So we are looking at different campaigns. The 95210 is just focusing on behaviors that will help individuals maintain a healthy weight or get to a healthy weight. Sleep, of course. 9, it ranges, 7 hours are required for a good night's sleep for adults, and 9 for children. So that's what that is. The 5 fruits and vegetables, trying to get in 5 fruits and vegetables every day. 2 hours or less of recreational screen time. 1 hour of physical activity, and 0 sugary drinks or tobacco. So these things, just focusing on one, can really make a difference. So when it comes to healthy eating, just some tips that can really make a difference. Planning ahead, of course. Preparing your own food if possible. We'll be working with the restaurants as well to make it easier for you to be able to know what the healthier options are. We're doing a little bit better. In other states, they're even further ahead, and they have nutrition information required on the menus. Another thing to do is just to make your plate more colorful. So it's just a simple thing that you can do, and add some color to your plate. Avoiding processed foods. This is part of our problem. We're not sure what's in some of these foods. Something has changed, things are different, the grains are different, and it's causing children to develop much earlier. So you get most of your nutrients from the fresh foods and healthy foods, so avoiding processed foods. Shopping on the perimeter of the grocery store. Of course, avoiding sugar, and especially sugary drinks. They're just empty calories, and that's a very simple way to help make a healthier choice for in healthy eating with your nutrition choices, just switching to water. But there's different things you can do if you're not drinking water already. Adding fruit to your water. I put fruit in my water, and now they have these little cups where you can actually put the fruit in the cup, and the flavor it releases into the water, and it's really good. So that's another option. But sugary drinks account for a lot of our problem when it comes to obesity. How much physical activity do I need? 30 minutes a day, 5 days a week, and that's just from American Heart Association, to keep your vessels healthy and your heart healthy. If you are looking to lose weight, increase your fitness levels, you would need more like 60 minutes a day, or about 300 minutes a week. So what we are encouraging and what we are trying to do, work with the county and work with the schools, is to help people be able to fit activity into their everyday lifestyle. So encouraging them to walk when possible, but taking a look at the sidewalks and the neighborhoods and things like that. So what's going to make it easier for you to say, okay, I can walk to the store, or I can, we just get in the car and drive, and then we go to the park. But why don't we have sidewalks that go to the park? So we're looking at those kind of things in the community. Just simple thing like taking the stairs, if your building has stairs, and if you're able to take the stairs instead of the elevator. Choosing family activities that are a little more active, just getting out, taking a walk after dinner. 2 hours or less of recreational screen time. That's a big problem as well with cell phones and technology and computers and things like that. So if we're not doing that, we'll be more active. So it's just little things you can do to sneak in a few minutes. So thinking about that, how can I sneak in a few minutes during your break time, taking a walk? And again, the stairs, that's a great way to get some exercise, just a few minutes, and it is proven to be beneficial. 10 minutes, 3 times a day is just as beneficial as 30 minutes, so that's good. If your job requires a lot of sitting, walk around the block or to, maybe a bathroom on the farther end of the building, but definitely taking some time to stretch at work periodically. At our health department, we have stretch and flex, so they play music. It's just a real quick reminder to take a minute at 10 and 2 to get up, move, stretch. So it's very good for your body, but of course for your mind too. Really important. Get your eyes off the screen, just clear your mind for a minute, and then you're going to be more effective when you get back to work, and it's going to be good for your body also. So just a couple of things we've been doing in the community. In April and May, the City of Newberry and Alachua County received the Healthy Weight Community Champion recognition. And so that is just taking a look at everything in the county, the schools, the City of Gainesville, the worksite wellness programs, what we're doing to support healthy weight. So we're taking a look at that, but we're also going to use it to improve and to gain support and to try to get funding to improve all of these things. The Surgeon General is taking this as a top priority. He's been to Alachua County twice already for the Healthiest Weight Florida initiative. He was here in January to the Coach Wellness Walks, which the Alachua County Medical Society put on, and we partnered with them and several other organizations. Just encouraging you to get out to your local parks and walk. This was held at Santa Fe College, and people met each other, and the idea was just to get out and use the free resources that are available and walk, meet other people, and walk with them whenever you can. There was music and a lot of different organizations involved. So this is just showing this Pop Warner girls came out and were cheering. We had some of the coaches from the University of Florida, different wellness leaders come out. We're also encouraging, if you have children, to engage them in physical activity. A lot of the schools have the morning mile before school, and it's free and open to everyone, so they can hop in and get a couple of laps in before the school day starts, because physical activity is unfortunately, such an issue with trying to get in more minutes into the school day. So how can we help our children to get it in before or after school? So encouraging the after-school programs are great. In Alachua County, there's so many different options. So helping children choose the active choice and something that they'll like, and it's got to be fun, of course. So there's a lot of different options. We also we started the wellness walks at the Fred Cohn Park, and they're still going on through next week. And again, it's just like the Coach Wellness Walks, an opportunity to come out and walk. Before you walk, we've partnered with the physical therapy students. You can get your blood pressure, you can get different biometrics taken, and you'll also receive some prizes, bags, and we have some real nice water bottles with different things. And the idea is just to come out, use the park, and try to schedule that into a regular routine. And we're partnering with the Medical Society for that as well. And here's just a list of resources. The CDC has a really good information page on unhealthy weight, which of course will give you more information on BMI and on nutrition and physical activity. ChooseMyPlate.gov has great recipes, also some really good tips on hitting the grocery store, eating healthy on a budget, because it's one of the main concerns. How can we eat healthy and affordable? They've got some great plans you can just print out, or you can take a look at and write down in a notebook. So just trying to make it easy for you when you get there to make the healthy choices. EatRight.org is another great resource. And then also the Healthiest Weight Florida website. And I believe that's all. Does anyone have any questions? No? Thank you. Yes?
Where can we find this?
The Healthiest Weight Florida?
No, the slideshow that you just showed.
Oh, okay. I can send it to Rod, and he can get it out if you'd like.
That would be great.
Sure. Anyone else? Thank you.
Thank you, Courtney.